Our guest today is Teresa Garcia Fitzgerald, Director of Business Development for Astra Health. And it's a special pleasure for us to have Teresa because we have known her for a very long time and we really enjoyed catching up this morning at coffee.
Absolutely.
Yeah.
Absolutely.
So first, Teresa, if you would tell our listeners a little bit about your impressive background.
Thank you, Kathy. My name's Teresa, and first of all, I want to say it's an honor to be here today. Anytime that we have an opportunity to spread the word and educate folks on services that they're entitled to is a good day.
Absolutely.
Yeah, it is.
So I have been a nurse for the last 25 years. I'm very passionate about the community and making sure folks have access to the services that they need. I've spent the last 20 years in home health. I have found that this is the sector of the industry where I can really make a powerful impact. To me, nursing has always been an art. And so when I can take the time with the patient and their family, for me, that's what it's all about.
And you are a nurse, correct?
Yes, ma'am.
Yeah.
Yes, ma'am. For 25 years. So I've just
25
revealed
years.
that I'm not 21.
But you were very, very young when you started.
Yes.
Yes.
And you still
a
look very,
baby,
very young.
practically.
Yes.
Thank you. Thank you. Congratulations on your vision.
So for our listening audience, just maybe that haven't used home health, kind of what is home health care?
Home health is a wonderful service. It's a service that's covered at 100% by Medicare benefits. It's a service whereas a visiting nurse, a physical therapist, occupational therapy, speech therapy, social work, and home health aide come directly to the patient in their home. I don't know about you guys, but when I'm not feeling well, I like to be home.
Yeah.
I actually think that when I'm not feeling well, I should be home and that people should come to me. It kind of takes us back to the old school philosophy of visiting doctors back in the day.
Absolutely.
How they would come to people's homes. So we still carry out that service. Medicare covers it at 100%.
And with the changes in a lot of what's going on in the healthcare industry, it looks, we were talking about the care at home, it looks like things are trending more toward that's where everything is going to be done after surgery or after a hospitalization.
It has. I think we're dealing with a society that's more vocal on what they want. People don't dream of the day that they go to a nursing home. There is a time and a place for it. But for the most part, people want to go home. Statistically, it's been proven that people get less infections at home. People heal better at home. People have less stress when they're in their own environment and their family can visit anytime, not just visiting hours. It releases a burden that's placed on an individual and their family when they are hospitalized.
Absolutely.
So it's 100% covered by Medicare.
Yes.
Cool.
And the service is intermittent, which means it's not every day and it's not 24 hours a day.
There's also a trend in the industry of we talk about rehospitalization, and Astra Home Health is like at the front end of this, of helping people not be readmitted to the hospital.
You're 100% correct. And I think a lot of folks get this impression or have this experience rather when they go to the hospital, they discover a diagnosis and it just seems to snowball. I've been in and out of the hospital. You hear people say that.
Yes.
So there are a number of home health agencies out there. We are not all the same. Astra Health puts a very high emphasis on our education to patients, their families, their loved ones, on self-care and self-management. We want to give people the tools to manage their care at home and know when to reach out. Home health is not a service that is indefinite. We have a 2-month episode to make an impact with a patient and family. And that's actually not a lot of time
No, it
when
isn't.
you're talking about adjusting behaviors and lifestyles.
Mhm.
So we have learned and continue to learn how to be aggressive with our teaching and evaluate the patient for how well they're getting that information, how well they're doing, and then tweaking our teaching and our treatment accordingly.
Mhm.
So what's some typical conditions that you're encountering frequently when someone goes home? What type of things are we talking about?
Well, there's quite a range.
Mm-hmm.
For folks who go and see their doctor and get put on a new medication, something that simple could qualify them.
Mm-hmm.
And I say simple, but the reality is if a patient is given a new blood pressure medication and they don't have a follow-up appointment with the physician
Mhm.
for what's typically 1 to 3 months,
Mhm.
if that dose is too high or too low, that patient is going to have an adverse reaction.
Sure.
And so by having a visiting nurse involved, we're able to monitor the blood pressure and the patient's response and make sure that it's the most effective medication for them.
Mhm.
Anyone recovering from a hospitalization,
Uh-huh.
I would say, if I could just back up a bit,
Yep.
the biggest thing for home health is that an individual is homebound.
Mhm.
It's difficult for them to get out of the house.
Right.
Now, I assure you it was difficult for me to get out of my house today. However,
Mhm.
that's not the same thing as a senior who's on oxygen and in a wheelchair who has to get out when it's snowing.
Mhm.
That is a taxing effort for that individual to leave their home.
No doubt.
Mhm.
So if it's not easy for them to leave, they qualify for us to come in.
Mhm.
The conditions that would support home health would be any new diagnosis,
Mhm.
a flare-up of a diagnosis.
Mhm.
I had an asthma attack. I was in the hospital.
Mhm.
That would warrant ongoing observation and assessment
Mhm.
in order to optimize their recovery.
Mhm.
Fractures. We're approaching the winter season. People slip and fall and go into the hospital and are going to need some rehab at home.
Right.
Home health is a nice first step before a patient goes to outpatient therapy.
Mhm.
Number one, the home health is covered. The
Mhm.
safety within a person's home is critical.
Mhm.
The things that become important, getting in and out of the shower, in and out
Yes.
of bed safely.
Mhm.
And how does your family assist you in doing that safely
Mhm.
without hurting themselves?
Exactly.
So if a person gets home health prior to outpatient, we're able to make sure that they're safe in their home environment.
Mhm.
There is also a monetary cap on outpatient therapy services.
Oh, okay.
So it could get to a point where it taps into an out-of-pocket copay
Mhm.
for an individual, whereas the home health wouldn't do that. So it's an opportunity for folks to get 2 courses of therapy
Mhm.
as opposed to jumping right to outpatient.
Mhm.
Mhm.
People can qualify for both at different times.
Oh, that's really, really good to know.
And that's why I'm so glad you're here, because what our audience, what they come to us for, why they listen, is education. And that's exactly what you're providing right now.
Knowledge is power.
Knowledge is
And what is that phrase? If I only knew then what I know now.
Exactly.
Trying to
Exactly.
stay ahead of the game.
Exactly.
So, to reinforce that all are not the same, you guys have to submit a great deal of quality information to Medicare about the outcomes and whatnot of your visits. Do you not?
We do.
Uh-huh.
Medicare
Yep.
identifies quite a few metrics, performance metrics for agencies. These are all published. The data is available to the public. Despite having our guidelines and our conditions of participation, we are also accredited. And so that is another level of metrics that we adhere to.
Mhm.
Oh, yeah.
These are safeties that are put into place for our patients.
Mhm.
and guidelines that have been proven effective. So
Mhm.
it's our state requirements. We take it a further step by being accredited.
Mhm.
And then we take it yet another step
Mhm.
with our humanity
Mhm.
and really trying to provide folks with the best possible service.
Mhm.
It's not always about the bottom line. I'm very proud to say we're a Mexican-owned agency.
Mhm.
With our culture, we are very close with our families.
Mhm.
We also respect other people's cultures.
Mhm.
That's
One,
really key, especially in Chicagoland.
Yes.
I'm telling you, when you have someone coming in your home that doesn't understand what's important to you and your family,
Mhm.
Mhm.
it's, again, another burden you don't have to deal with. We
Mhm.
cut through that layer. And one of the ways we do that is we have a number of bilingual staff.
That is what was so impressive that we talked about this morning over coffee. I'm looking at this. I don't know if anybody else offers this myriad of languages.
I think the reality is people do recover better when they are told in their native tongue. And we do have a language line. Many companies do.
Mhm.
They're wonderful,
Mhm.
but it's not the same as having a live person.
We would agree.
Mhm.
And that's an immediate, just having those languages is an immediate stress reducer on a patient.
And
They're
it's-
talking in their own language. And, I know the English language is much different than, let's say, even Spanish, because just the way words are said.
Correct.
Spanish is more feeling, where English is more, or I don't know what they call it. I think logical or determined. And that makes a big difference to a patient.
You know, it does, and particularly when you're dealing with a geriatric patient.
Mhm. Mhm.
It's an opportunity for our staff to connect with them.
Absolutely.
Mhm.
And when you connect and engage with the patient,
Mhm.
you get far better results.
Mhm. Teresa, can we just go through some of the languages that you guys cover?
Absolutely.
Yeah. It's a lot. It's an impressive list.
It is.
Absolutely. So obviously, we have Spanish speaking staff. This is nursing and physical therapy. We have Polish speaking staff, Russian, Tagalog, Hindi, Urdu, Italian, Mandarin, Korean, and Greek.
Cool.
And that's phenomenal. And we all live in the Chicagoland area. I think you have everything pretty much covered there.
It's a very robust list.
Yes,
and I'll tell
absolutely.
you, I've been doing this for a long time. I've never been a part of an organization that has this many languages available, and I love it.
And that has to be that. I mean, that was a great strategic move for your company. I applaud your owner, because that is a huge need out in the marketplace.
It truly is. And again, this is of course the owner, Oscar, but it's Astra wanting to perform to a higher level
Mhm.
without being told.
Mhm.
That would dictate it to.
Mhm.
Going back to your, if I only knew then what I knew now. So many, if someone, from our observation, if someone is their first experience with the healthcare system, there's some things they just don't know, and they just assume what they're told is the way it is. And one of my personal things that I wish more people knew was, do I have a choice in home health providers?
Mhm. Good
Oh, you
question, Kath.
absolutely do.
Mhm.
Patients do not always realize they have this right.
Mhm.
Providers do not educate them that they
Mhm.
have a right. And if
Mhm.
they do, they say it quickly.
Mhm.
You have your choice of any home health, but we have our own, and we're going to go ahead and send out XYZ.
Mhm. Mhm.
And having been a patient in the hospital myself, usually the only thing a patient is thinking of is, I want to get home.
Mhm.
So you say yes a lot of times
Mhm.
without thinking it through thoroughly,
Mhm.
because the goal is for you to get home.
Right.
But
That-
patients do have a choice, and all agencies are not the same.
Absolutely. And that's our audience. today, Astra Health, we're talking to Teresa this morning, is a Class A organization. And that's why it's important that you realize that you have a choice when you leave the hospital. This is your health that you're taking care of. You have the choice.
And having known Teresa for a very long time, and when I found out Teresa was with this organization, I know Teresa would not associate herself with someone that wasn't a good organization. So that just, right off the start, we knew that we were with a good organization.
Thank you for
that. Was
that.
good. Yeah.
Over coffee this morning, we were talking about a situation that occurred. Can we talk a little bit about why it's important that you have prompt responses to referrals and patient needs?
Certainly. As we talk about the whole hospital readmission issue, people who do have a hospitalization, their goal is not to go right back in. And so we have some data available and some methodologies that have been proven to give agencies an opportunity to get involved and help folks before they become a readmission. We have high-risk timeframes. When you first get home from the hospital, that first 24 hours is critical. That's when most of them are going to go back. 48 hours is a big time frame for people to be aware of, because a home health agency by law only has 48 hours from the time they get the order or the patient is discharged until they get into that patient's house. Because that time frame is a condition of participation, it is a legal requirement. The only time we can sidestep that is when the patient says, I do not want you here until this day. Again, they have that right. And we honor that. But by law, we are responsible for getting into a patient's home within 48 hours.
And again, audience, please pay attention to that. The situation we were talking about this morning, no name is mentioned, but it was well outside that 48-hour window that was creating a crisis for, let's say, a client. They needed home health there. They do. So if you have home health and it's beyond 48 hours and you've seen nobody, give Teresa a call.
Call Astra Health. We'd be happy to help. We had a situation last Friday. One of our nurses, her neighbor, came home from the hospital. She had seen him in the past. Some people have chronic conditions, and again, they have those flare-ups, and then we get involved.
Sure. And
the neighbor said, I need your help. I got out of the hospital last week and no one's come to see me. And so we contacted that hospital and the patient's physician, and we let them know. And we're getting the paperwork to our office and getting everyone's approval so that we can go out there and help this patient.
So that touches on an important thing that people also don't know. A doctor needs to kind of order this service?
Yes. Our services are under the direction of a physician. So people typically have a primary care provider. Some folks are fortunate enough to be very healthy their whole life, and at 90 develop a condition, and I've never had a doctor. So one of the things we can do is line people up with doctors. We can get them visiting physicians. We have great physician relationships in the community. We know specialists, and we can help align people with a physician of their choice, whether it's to their office or have someone come into their home. Once that occurs, then that physician would order home health. It is a physician-directed service. And so, like I said, if you have never had one, we can get you one. If you have a doctor, but you now can't get to the doctor because of your weakness, it's another opportunity for us to bring a provider to you.
Folks, if we've generally been healthy, and knock on wood, I think Jim and I both are following that category. the landscape's changed dramatically. Like hospital stays are a lot shorter than they have been in the past, and stays at skilled nursing facilities are shorter than they have been in the past for like something like a knee replacement or
Correct.
hip. And so could you just
I'll touch
talk
on that
about that a little bit? Because people,
Absolutely.
I think, maybe are clueless, like us, if they're healthy and don't know the industry.
Right.
Absolutely. So in the past, people would get a knee replacement. They would stay in the hospital about 3 to 4 days. They would then likely go to the inpatient rehab, which would be the rehab unit on the hospital, which is a little more intense than at a skilled nursing facility. If they didn't go to rehab, they would go to a nursing facility and get their rehab there. It was typically 2 months of rehab they would get, and then they would be discharged, and then they would get home health, and we would see them for 2 months, and then they would go on to outpatient therapy. Believe it or not, in this day and age, people are getting knee replacements, going home the same day,
Wow.
and they're going to outpatient directly.
They're
have
going out.
skipped.
They have to get there then.
They have skipped the rehab,
Wow.
both inpatient and the skilled nursing facility. They've skipped home health, and they've jumped directly to the outpatient.
Wow.
And their results are incredible. So the trend, when the results are incredible, the trend is going to be to continue to push people down that track.
That's exactly right. It helps, I think it helps the patient mentally to get right out. And
Absolutely.
It's riding a bike, right?
I mean, it really is.
Yeah, it's riding a bike. But some people need help getting there, and that's where Right at Home can come in, and we
Get you there.
and
Yeah.
this is why that was a good question, Kath, because this is something that we've seen starting to trend now, that we're getting a lot more calls for that.
But hip replacement is similar track right there. That's
A
fast
hip
track now.
replacement is also on a fast track. And so hip replacements, again, they've carved out the acute rehab and the skilled nursing facility rehab. They're no longer on home health for weeks. They're on home health for 2 weeks.
Wow.
Wow.
Or they're going directly to outpatient therapy.
That's amazing.
Just to touch on some of the, comorbidity issues, someone may have been in the hospital for a knee replacement or a hip replacement, but and they may have a specific specialist that has maybe done the surgery, whatnot. But sometimes they're actually going home with this, but they have a lot of other potential health issues that need some attention.
You're 100% right. For the majority of folks, they don't have just one diagnosis. And although they've been able to manage their diabetes or their COPD, once they're in the hospital and they go through a surgical procedure, the body responds accordingly. And so sometimes their blood sugars aren't falling in line because their body's healing from this surgical procedure. They may not being in their own environment, they may have breathing issues after being intubated and going through the anesthesia. And so although the knee replacement's the issue, now we're checking blood sugars to make sure they're not getting too high. Now we're on breathing treatments because we're not up and walking around. And so being able to manage all of those conditions, not just the knee, is going to optimize their health.
So that hence going back to home health, sometimes it might not be obvious for the knee replacement, but it may be obvious if you take their whole health condition into consideration when they go home. Right?
Yes, and actually I like to think that home health does that in a day and age where healthcare is fragmented and compartmentalized. Nope, I'm just this doctor. I check you from the neck up, and nope, I'm just your bone doctor. Home health is a service that actually looks at the big picture.
Which is critical because
It's
of what you
critical.
just mentioned. Home health looks at the whole situation.
It certainly does.
So
Not everyone's environment is the same.
Right.
Not everyone's finances are the
Mhm.
same. Support systems
Mhm.
are variable, family dynamics. And if I could just touch on dysfunction in family dynamics, it exists in every family.
Mhm.
Yes.
Every
yes.
one of us has it.
No.
Yes. Sometimes we have multiple levels of dysfunction. And so an individual who looks like they would have a promising, successful recovery may have a son who's an addict stealing pills.
Yes.
And we now have a major issue on our hands
Right.
that no one except professionals inside that home would have been ever alerted to.
Right. So true.
We only have a couple minutes left. Can you cover very quickly your service area?
Absolutely. We are able to service from Chicago all the way to Rockford. We go from the Wisconsin border. We cover DeKalb County, Kendall County, Will County on the southern parts. Astra Health is based in Harwood Heights, which is near Norridge on the outskirts of Chicago.
Mhm.
That's our corporate office. We also have an office in Algonquin, our branch office, and that's Astra Health West, and that's located on Randall Road in Stonegate.
Cool.
Oh,
Know
wonderful.
where that is. Yes.
Yeah.
Yes. Cool. Now, how about your contact information? Let's don't get away before we get that from you.
Absolutely. I'm not sure which contact info I should give. So I'm going to do what I always do and give my cell phone because that's the number I answer.
Mhm.
And if you like to text, I'm a good texter. And at the end of the day, I love helping people. And if what knowledge I have in my head helps a patient and family, then I'm going to share it freely. My cell phone number is 847-846-3666. I know there's 3 6s in that phone number.
Yes,
Please
yes.
don't be scared. It's a number I've had for 20 plus years.
There we go.
And believe it or not, people remember it.
There
And
we
so
go.
again, if it makes it easy for folks, I'm on board.
Your website?
Our website is astrahealth.net. AstraHealth.net. And real quickly, for those of you who don't know, Astra means to the stars through difficulty.
Oh, I like that.
Isn't that great?
That is deep.
It is deep.
Cool, cool.
I love it. Guys, thank you
Thank
so much for this
Thank you,
opportunity.
Teresa, thank
I've
you for
really
being
enjoyed
here
myself.
today.